So this is very interesting understanding for a person who wants to learn traditional Chinese medicine and the pulse diagnosis according to traditional Chinese medicine. For those students who are in this hall, I have written something on the board, but those people who are online, they might not see the board. I'll write it on other, on a digital platform, and you can go through it, and also you can see it in the description below. So in pulse diagnosis, in the left hand, there are three superficial and three deep areas. Each of these pulse denotes one particular organ of the traditional Chinese medicine. So if it is a left hand, I'll feel the pulse here with these three fingers, and each time I have to, the physician who is checking should be very good at his own health. So if the physician is not healthy, he should not check the pulse, So pulse is a reference for a physician. Check his pulse for the standard reference that he is healthy, and then check the patient's pulse. The physician should be at good health, calm and relaxed. He or she should be receptive, silence, and the pulse should be checked around 5 a.m. to 1 p.m. And the patient should be resting for about 10 minutes so that the chi is getting balanced, or energy is getting balanced, or the cardiac activity is becoming normal, so that pulse can be felt better. Patient can be in recumbent position or rest position. For a male patient, start seeing the left wrist first in pulse diagnosis according to traditional Chinese medicine, and in the female patient, start seeing the right wrist first in traditional Chinese medicine examination of pulse. So when it comes to superficial part of the left wrist pulse here, we feel there are superficial part. First point is intestine, second one is gallbladder, third one is urinary bladder. In the same pulse, when I go deep and feel the deep pulse, the first point is the heart, second point is the liver, third point is kidney. And in the same way, when I check the right pulse, right wrist pulse, when you check it, so deeper part you will feel lung, spleen and pericardium, and the superficial part you feel large intestine, stomach and triple warmer. So just have it in mind that left hand 3 superficial, right hand 3 superficial, left hand 3 deep, right hand 3 deep. How to correlate this, I'll tell you in short while. And notice that when you are learning about the pulse diagnosis, you need to be absolutely conscious, and you should have the knowledge at the back of your mind, and then feel the pulse of the patient. Then you will be able to analyze and see what meridians are deficient, or what meridians are increased, or what meridians are decreased, and what acupuncture points you can use it for treatment of the patient. So right diagnosis depends on the right way of examination, receptive way of examination with the knowledge. Once you have a good knowledge, the knowledge can be converted into wisdom, where the healing can happen automatically. Thank you.